Most women will know what thrush is because they've had it, at least half of them anyway. Thrush is a yeast infection and it tends to affect women in the vagina in the same way that it most commonly affects men inside their trainers. Both areas are warm, moist and airless, and that's where the yeast that causes thrush is most likely to thrive. Certain things can make you more prone to getting thrush, and avoiding these can reduce your risk. So probably can't avoid getting pregnant, but do be aware that you may be at higher risk of thrush if you are pregnant. You can avoid wearing tight clothes, especially leggings and very tight jeans, which make you more sweaty. You can avoid wearing synthetic undies, which again make you more sweaty. You may be able to reduce the number of antibiotics that you take. Think very carefully about whether you really need them because they can increase your risks. Also, using very heavily scented washes and soaps down below, and particularly vaginal moisturisers and deodorants, can increase your risk of thrush by irritating the skin, so try and avoid those. What do you do to treat it? Well, I think everybody knows what the symptoms are: a white, creamy, sort of cottage cheese-like discharge, often associated with intense itching and vaginal soreness, but no tummy pain, and you're well in yourself. You should know what the symptoms are, especially if you've had it diagnosed in the past. First time round though, do go to your GP or an STI clinic, a family planning clinic for instance, and get yourself checked out to make sure there's no other infection going on. Once you know that that's what the symptoms mean, you don't need to go to your doctor. You can get a prescription from your pharmacist, or you can buy a treatment from the pharmacist. These days, most women will have their symptoms controlled with just one pessary that's popped in at night, a bit like a tampon. Sometimes you might want to use cream to go with it to reduce the itching. But certainly, if you're getting repeated attacks of thrush, or it proves hard to treat, you may find that taking a tablet by mouth will not only get rid of it, but will also prevent it from coming back for a few weeks. So your pharmacist should probably be your first port of call. But if your symptoms aren't settling, if you get thrush anywhere other than in your vagina, especially if you get it in your mouth and your throat, if you get it for the first time and you're under 16 or over 60, then do go and speak to your GP.